My name is Marlyn Mayo. I'm a professor of medicine from UT Southwestern in Dallas, Texas, in the Division of Digestive and Liver Diseases. I'm a hepatologist, focuses on cholestatic and autoimmune liver diseases. The rationale, I think, was really to try and raise awareness of pruritus as a very common and underestimated and undertreated symptom in primary sclerosing cholangitis. Traditionally, pruritus has been overlooked in the field of PSC. It's really much more common than we realize, and in order to increase awareness, we need to meet physicians where they're at. We need to know what their current thoughts are and their current opinions on pruritus and PSC, and so that was why we undertook the study. So this was a international study across multiple countries, predominantly Europe, and what we looked at was what are physicians' positions on itch in primary sclerosing cholangitis. How often do they ask about it in the office? These were predominantly physicians who had a fair amount of experience treating PSC, who had been doing so for at least 5 years. How often they ask about it? What are the barriers to not asking about it? We looked at treatments that they were using, and how often they were using those treatments. And we asked physicians kind of what their needs were in terms of dealing with pruritus in PSC patients. The results were that physicians felt that they were assessing pruritus like at every visit, 60% of the time. I have a feeling that's going to be an overestimate, because whenever we ask physicians how often they're assessing a symptom in the clinic, they say, oh, I do this all the time. And then you turn around and ask the patient, how often does your doctor assess the symptom? And they will say, they've never asked me. And so there is a second part to this study that's going to look at patient responses, and it's going to be interesting in the future to see how those compare. The vast majority of physicians felt that that there was a need for a measure which was easy to do and quick and reliable and validated in PSC specifically, that they could use to quantify pruritus in the clinic. As far as treatments, the most common treatment was ursidiol. It was interesting to me, despite the fact that many of the sites were from Europe, that the use of fibrates to treat itch in patients was only about 11%, even though that is designated as first-line treatment in the European guidelines to do that. So clearly evidence that this is being undertreated. And they also listed the things that are barriers to them in terms of assessing pruritus in the clinic. And it's the things that you would expect. Time, if the patient doesn't bring it up, I don't bring it up. I'm focusing on treating the underlying disease. I mean, I would hope that physicians would become more aware. As I was standing, there was this poster, and as I was standing there, people came by and said, we've always thought that pruritus happened in like less than 10% of PSC patients, but clearly that is not the case. That it is much more common that, and we need to, educate ourselves as to how common it is, and we need to start asking. And I think that will come out of this research and other research, and when we see what I predict is going to be a discrepancy between what doctors think they're doing and what patients think their doctors are doing, that increased awareness will allow us to recognize this problem, and hopefully, ultimately, if we recognize it, then we'll start to try to treat it, refer these patients to clinical trials.